On behalf of the American Academy of Neurology and in collaboration with Neurology Today, it gives me great pleasure to introduce Dr. Divya Singhal. She's an associate professor of neurology at the University of Oklahoma and the VA residency site director there. And she was also the lead of the residency program wellness work group. Really looking forward to talking to you about wellness initiatives. Maybe we'll save that for the end. And also a member of the Live Well, Lead Well program faculty. Divya, thanks so much for joining us today.
My pleasure. Thank you for having me, Dr. Isaacson. It's been really fun working through AAN on a variety of things, including with Dr. Milstein, a Live Well, Lead Well.
Cool. Yeah. The commitment to education that the American Academy of Neurology has is striking. As we've participated in it, I think we've both learned more about, wow, through the tentacles and through the DNA, I guess, of the AAN, there's just so much there. And it's kind of echoes what's going on in Oklahoma. David Gordon is your chair, and I remember him when I was at University of Miami, and his commitment to education has been striking, and what's happened at Oklahoma over the last 15 years or so has just been awesome. So I hope you've enjoyed your time there. You've been there for, 6 years, and then you've been the site director for about 4 years or so.
Exactly. I really enjoyed my time with Dr. Gordon. It's been a great learning experience. I joined it because I joined this program. I liked his vision. And then seeing how he's really helped his faculty also develop their clinical educator skill set is really rewarding. I love working with the residents. And enjoying the work locally is kind of what inspired me to get more involved with the Academy as well.
Cool. So I guess we'll talk about COVID-19, its impact on GME. And, earlier this year, I got to have a great conversation with Dr. Jaffer Khan. He's the chair of the GME subcommittee. He's a great guy. He and I talked about having pina coladas after education meetings. We won't talk about that just yet. But we talked about the transition to virtual learning. What has this been like for your residents, for the people that you've been teaching, students, et cetera? How are you dealing with this, and how have the residents adapted?
That's a great question. So you're right, COVID has been something which has been rather sudden, and as Dr. Khan and you had discussed, it's really been a global change, which was rather overnight or in a very short amount of time. So the way my involvement is more with the residents, with the medical students, it's been more peripheral. The way we evolved it was by taking everything virtual. All of the didactic sessions have been made 100% virtual, all with Zoom compatible. So that was done very quickly. And as you can imagine, for medical students for a while we were uncertain of where things would be, they were taken out of hands-on rotations, although that's been gradually introduced in a safe and scaled-back manner. Gotcha. For residents, there were a lot of changes in terms of minimizing the need for potential exposure to COVID while things were being figured out. Mm-hmm. And then there has been a gradual reintroduction in a safe manner, of course. And to your point of what their experience has been, it's been a dramatic change. I'm really heartened and proud to say they've been extremely flexible. They've been very adaptable. They've helped each other out. As I'm sure you must have experienced as well, there are a lot of unexpected quarantine being done for residents and things. They've been fantastic about covering for each other. The didactics going entirely virtual has overall been a really fulfilling experience. They miss the camaraderie of being able to be in the same room with each other. But Dr. Gordon's preference for making sure most of them turn their cameras on allows them to at least virtually be there with each other as much as possible. Right. And the one silver lining of virtual didactics is that it allows them to attend a lot more sessions. These recordings are available, and also they can attend a lot of national and international virtual sessions that previously they may not have been able to attend to. So for instance, a lot of them are encouraged, and when I recommended they're signing up for AHS, for Movement Disorder Society, upcoming ANA meeting, a lot of things which they previously could not have attended if they were on wards.
Yeah, I agree. It's interesting because, Morning Report is one of our, trademark conferences, 4 days a week. It's kind of when everyone gets together, but, everyone getting together, the room is only so big. People are still running late. Now with Morning Report, triple the faculty. That's an important aspect too. And we now have a system in place to really, be able to talk in place and to really interact. But I would say at least a 20% increase in resident attendance. Also from Morning Report, noon conferences, I would say at least a 20, probably 30% increase. Plus we're recording it. It's easy to record. We're not sure how many people are actually watching, but all the faculty are uploading their slides. Chiefs are really creating a nice digital library of these resources. So I agree. It kind of happened out of the blue, and we had to make a change quickly. But exactly, the silver lining is, maybe this is good for education, and maybe some of these kind of experiences will stick throughout time.
That's well said. Ideally, we would never want a pandemic to happen to anyone at all. But if there is a silver lining, that's something perhaps we can take forward in a positive way.
Yep, totally agree. So I definitely want to talk about wellness, and I think we'll honestly probably spend most of our time on wellness. But before we get there, let's talk about this whole interview season. I was talking to our program director, a great guy. I know he knows you. Said very, very nice things. Says hello, Matt Robbins. And Matthew Robbins has been the program director now for about a year and a half or so at Cornell in New York City. And how do we say it? I don't really know what it's going to be like for this whole remote virtual interview. I mean, coming to a residency program, and I remember that the program that I decided to rank first, the reason I did that is because I walked into the lobby, remember it was the Shapiro Clinical Center, and I walked in and I said, this is it. This is the right place. Like I felt it, which is a strange kind of feeling. How do you think institutions are going to handle the interview process? What is it like for residency administration? And then how do you think the prospective residents, the medical students who are interviewing, how do you think interview season is going to be this year?
That's a great question. First of all, a hello back to Dr. Robbins. He's a fantastic colleague to have. The residency interview season is definitely different. Another silver lining here is that we've had several months to be able to plan and adapt to it. So this process we're starting out of the blue in August or September, it might have been a bit more disconcerting for administration as well as for future residents. But the fact that everyone's had time to adapt to a virtual world, virtual weddings, virtual social occasions, I think has given us all some time. So I'll separate out the residency program perspective from the future residents. So for the residency program, locally speaking, the chair, Dr. Gordon, the program director, myself from the VA side and the APD kind of brainstormed along with the other residency recruitment faculty. And a couple of things we came up with were it's not the same, but trying to get our applicants to get a feel for the program, to give them a virtual tour and to do a recording, a virtual guided tour with current residents, and then different aspects of the program being presented by the chair and others involved, which can be viewed beforehand. So it gives them a better idea and sets the stage for the day. And then also trying to simulate the residency dinners, which typically occur the day before the interview in a virtual environment. Right. So the residency applicants still get a feel for what it's like, and it's an informal session for the residents and future residents to get to know each other. Right. Outside of Oklahoma, more on a national scale, as you may be aware, the Academy, the Undergraduate Education Subcommittee, and Graduate Education Subcommittee have been doing a lot of good work trying to help program directors navigate. We work together to create these toolkits with Dr. Gregory Cutsford, Dr. Sony, and others, which is really a great toolkit for program directors as well as for residency applicants. And then coming to the residency applicants, it's definitely going to be a different experience, something that they aren't quite used to. But I think everyone's adapting the best they can to make the most of it. Another silver lining here is that it's universal, so it won't be someone having to choose that difficult decision. Right. And speaking of silver linings, I'm hoping that the reduced financial burden of having to travel, figure out logistics, all the flight delays that occur in cold weather will hopefully be offset and allow for a better experience. It won't be perfect, but as perfect as can be in an uncertain time.
Yep. Yeah, I remember I had to take out a, it was termed a medical student relocation loan, but you could take it out like within 6 months of graduating or something. So I ended up taking, you could take up to $10,000, but I was trying to be cost conscious. I took out $7,500, and that loan, like literally, that was the only way I could have done interviews. Here, you can really sit in front of your computer and not have to have those expenditures. And I agree, the coordinating and the sleeping and the either sleeping on a couch that you can find for free or finding a hotel, especially in some of the bigger cities, which is quite expensive, you know, during peak season, during the holidays. So I agree that in terms of silver lining, especially for residents that are having a tougher time with affording things, especially with everything going on with COVID, whether it's a family member, you know, losing a job or having trouble in a variety of ways. I think that's, again, totally a silver lining. I don't know that this is, you know, in terms of like recorded interviews and recorded lectures and online lectures, I think that's definitely going to stick. I don't know that these types of, you know, recorded interviews will stick for residency. Maybe for fellowships, there will be more comfort with it because the whole world's just a little bit more comfortable with the Zoom point of view on things. You said Zoom weddings, agree, already been to one. Unfortunately, doing funerals. I mean, we've literally experienced life in such a different way that, maybe this will have a positive impact, at least on the financial aspect of things for trainees, as we go forward.
You make an excellent point, Dr. Isaacson. Even for the fellowship interviews, that's something that's already occurred, and I got feedback from our residents here who've interviewed for headache and movement disorders. It was definitely a different experience, but all in all, they did get a good sense of the program, which is nice, and they've interviewed for a variety of fellowships. And it's interesting, I agree with you that the didactics will likely stay in some form or fashion. Ideally, if given an option, I think a lot of us would love to go back to live residency interviews in the future. The one benefit that's hard to replicate is the residency applicants getting to know each other as they make their journey across different programs. Right.
Yeah, I forgot. Actually, I didn't even think about that. Because when do you get time to split a cab or talk during breaks? I probably stayed in touch with at least 3 or 4 people that I met on the interview trail. We all went our separate places. One went to Yale, one went to Brown, one went, there's a lot of East Coast, kind of the East Coast crew. We kept seeing each other across all sorts of interviews. But that was really helpful because you could see what it was like to train at other places, and you could stay in contact, and it helped even for fellowship interviews if that was in the same city. So that's interesting. I guess we'll have to figure out a way at the American Academy of Neurology or at the annual meeting or some way to introduce camaraderie, because without that, getting to know, it's a small world, neurology, don't get me wrong, but getting to know that crew during interview, it's a special time.
It indeed is.
Yeah. So let's talk about some aspects with wellness. So I touched on earlier about, for example, unemployment. Unemployment, I think a lot of people think, unemployment would be restaurant workers and, other cruise ships, the hospitality industry, a lot of decimation in the entire industry. When it comes to, finding a job, you just spend X number of years in college and med school, say 8 years. Some people do PhDs, master's degrees, they had 2 to 4 years from that, some research years. We're talking, 10, 12, 15 years of training, and then you do residency and a fellowship, and all these years are adding up. And, I know fellows who were basically about to enter the job market, and all of a sudden their job offer was, maybe they didn't call it pulled, but it was, we're going to have to delay for a year where we have COVID-related, monetary expenditure cuts. Before we talk about, the traditional wellness things and, from, wellness in a pandemic and the day-to-day in a residency, how do you think that this, this change in the job market and, knowing that, I know a physician that worked her tail off during COVID and volunteered to do anything and everything that she was called upon. And then she didn't have a job, and then, isn't going to start work till October 1st. And great that she found a job, but, well-trained, Ivy League, all that mumbo jumbo, could not find a job to start within a tri-state area where she was living, top resident, top fellow. How do you think that has gone, and what advice would you give to residents or fellows that may be worried about something like that?
You bring up really a good point, Dr. Isaacson. It's probably the biggest elephant in the room for current and future residents and fellows who are entering the job market. Because you're right, we've never had a time before, at least that I'm aware of, where physicians or physicians in training had to worry about the certainty of their future. Yeah. It's never happened before. As you can imagine, a lot of things until January of 2020 we would have thought of as unfathomable are today's reality, and this is one of them. My sincere hope for the future is that if we stay the course, as Dr. Khan had said in a prior interview related to this topic, things will get better. I do believe that there will be some changes to how current and future trainees view their career trajectory, as well as the ways they adapt. Similar to a colleague you talked about, I had a really bright and amazing resident recently go through a similar experience. It was incredible to see how he navigated that path and pivoted it into a fellowship, which would have an additional benefit in a year and hopefully lead to better opportunities. But in the meantime, for one, based on what their life plans, family, and other aspects are, it can be really challenging. And just telling someone at the time that we're luckier than others is not necessarily very comforting. Right. So it's definitely very difficult. One thing I would encourage current trainees as well as faculty and mentors to be thinking about is perhaps broadening our scope of what we consider as our future pathways. Just as an example, those who may have been set on a certain way they want to practice, whether it's a certain subspecialty, niche focus, or whether it's a certain geographic area, they may want to be a bit more flexible with it. It doesn't guarantee things, but I'm hoping if we stay the course in the next 6 to 12 months, things will change.
Yeah.
As we both know, the need for neurologists will continue to rise by up to 25% within the next decade or even less.
Yeah.
So once the pandemic has settled down, which hopefully it will, the need for neurologists will only grow and flourish.
Yeah.
Fortunately, being within a federal system has been protective to many, but I know of many other colleagues who are not that fortunate. So perhaps just expanding their network, asking trainees to reach out to current or previous mentors, advisors, and seeing what options might be out there, and asking them to be planning a year or two ahead could be helpful.
Yeah, that's great advice. Expanding the skill set, reaching out to others. I'll be honest. Like for example, I've kind of had my head in the sand doing my day-to-day job work in Alzheimer's prevention for a long time, and I barely had enough time to sleep and go to the bathroom. So I've been doing a lot of my day job work, but there's other stuff out there. There's consulting. There's expert opinions, there's CME lectures. So there's other stuff out there that, can soften the blow a little bit. It's not going to replace a job, but I think this has been important. And I've given the same advice. I have a stroke fellow that just became a recent faculty member and, was worried that if they don't make their bonuses are, a big part of their livelihood. How is he going to pay for his rent? How is he going to pay for his school? The guy's an extraordinarily well-trained person. Doesn't matter. Doesn't make the bonus because clinical volumes are down and the pandemic is hitting and people aren't coming to the hospital. That's what's going to happen. So I think getting physicians to kind of think outside the box. There's honestly a lot of good websites I've followed for this. I won't endorse any or say any necessarily, but there's some websites out there of blogs and people talking about this. And it's I've paid more closer attention to my retirement. I just put that all on autopilot and just let it go. Now I'm actually paying attention. And when the market dips, I say, hey, you know what, maybe $1,000 extra in the market this month. Maybe, I'm not a stock trader, not a day trader or anything like that. But I guess I've realized that while I became a doctor to help people, a very nice silver lining benefit of being a doctor is the security. I'm always going to have a job and that's going to be good. Wow, that's not exactly the case, but as you said, as Dr. Khan said, stay the course. In a year, 2 years from now, this will be behind us, and this will be a blip, I believe, and then the demand for neurologists only go up. So, okay, so we waited a long time for the most important part of our conversation. So, hope people are still watching. But what I would say is, residency and medical education is stressful enough without going through a pandemic. With your focus and your experience in wellness and all the different leadership roles and projects you've done, what sort of stress reduction or wellness tips would you share? And I guess, what sort of wellness practices do you suggest to your residents, interns, students, or whatever in their daily routine in terms of, maybe what's different now during the pandemic versus what are some of the normal suggestions and advice you give to trainees?
You're absolutely right, Dr. Isaacson. The concept of wellness and well-being has changed dramatically pretty much overnight for all of us. So unpacking that excellent question a little bit about how has it changed during COVID, as well as what is individually applicable. A lot of it will depend on where one is at in their life. What I mean that is, for instance, are they a medical student, resident, or fellow? Are they the sole provider for their family versus they just moved to a new geographic location where they don't know anyone versus they had a certain plan, as we talked about, certain jobs that have fallen through. So depending on that, their wellness may look different. The biggest experience and understanding I've had is that we all will go through ups and downs. And it's okay for us to acknowledge that with each other in a safe space. No one is perfect. As physicians, we are said to be extremely stoic, but even a giant has their moments of not feeling the best or being at their best moment. So being able to acknowledge that in a safe space, preferably away from the work environment or where acute things are happening, is important. And being okay feeling vulnerable, especially if there's been a tragic event with a patient they were caring for or with a colleague or a loved one, and not being able to be there, it's a very traumatic experience that they haven't had before.
Right.
So I think acknowledging the grief is an important part, and understanding that there is solidarity and unity here. A community spirit has become more important than ever.
Yeah.
One of the very silver linings here is that globally, everyone's been affected at the same time, which has perhaps not occurred at least in several decades. So at some level, there is a mutual joint shared understanding. COVID has put a highlight on how important the role of physicians and all healthcare professionals is. So there is an underlying empathy. At the same time, it's been a huge stress point. So if we can all stay together, that helps a lot. I know at our program, our residents have had a WhatsApp group for each other pre-COVID, which has become even more important for them.
Right.
Checking in with them proactively, myself and some other faculty, just informally, is something that a lot of them benefit from. Some of the residents have chosen, and I've encouraged, they have a buddy system, someone that they really gravitate towards to check in either daily or periodically. And many of them have been amazing about just forming those buddy systems based on which service are they working on together, or if someone gets quarantined or something untoward happens, being there for each other. Speaking of what residents, fellows, and medical students can do on an individual basis, especially right now, my biggest suggestion would be for everyone to give themselves at least 5 to 10 minutes a day. It's easier said than done. And when I say giving themselves 5 to 10 minutes a day, I'm talking about apart from their obligations toward their family, work, pets, other things that are important in life, but just truly taking 5 minutes before they start their day, and if possible, 2 to 5 minutes at the end of the day, to be with themselves and do something that really brings them joy. It could range from just sitting and doing nothing to watching the show and thinking about something, or an outdoor activity that is possible with the current restrictions, or taking an extra walk with a dog, or whatever that looks like, or just a phone call with someone overseas. Something that's their moment to be with themselves, not be a doctor, not be someone stuck in a COVID, but just this individual who has time for themselves. Because as we all know, we can't really serve others if we are empty ourselves. So it's important to take care of ourselves. And also know that wellness is a continuum. We're not going to be feeling perfectly healthy and awesome all the time, but hopefully the best versions we can be of ourselves on certain days.
Well, I couldn't agree with you more. I mean, the topic of wellness hasn't been any, from my career, I guess I graduated med school around 20-ish years ago, but the topic of wellness in the last few years has just been, exponentially greater in the circles of my circles of neurology, and I think all of medicine. And I think that's super important. But I think the topic of wellness today in our current medical practice and society and kind of, what's going on in the world, exponentially needs to increase that more. With these videos that we've been doing, I at least 10%, 15%. I had a great conversation with Jennifer Bickle, that was a terrific. Jack gave great practical advice. Talked to Bob Roth. Bob Roth is a transcendental meditation expert. Taught me a lot. Worked with patients of mine, and he kind of says the same thing. 20 minutes of practice. Even once a day, but ideally twice a day. It's similar, and whatever works for that person. Great. I'm going to admit this. I don't know if I've admitted this before, but I play Pokemon. Like, I know it's like ridiculous, but I play Pokemon Go. I don't know why. It's 5 minutes. I almost do it every day. I'm on level 39. I no idea why I do this, but I just do it. And that's kind of my mindless thing of, this is not doctor related. Although I do have other Dr. Pokemon friends. Joe Softy, Dr. Softy is on Pokemon too. So you can give him a hard time for that if anyone's watching. But whatever it is, I couldn't agree with you more. Find that little niche that gives you, your escape from medicine and kind of grounds you in that way. So.
You said it perfectly. Dr. Bickle, Dr. Milano, Dr. Schwartz, a lot of them have done fantastic work in this field. And to your point of grounding, and whether it's Pokemon or for some it may be yoga, fitness, meditation, or anything, it's kind of helping integrate the left and right cerebral hemispheres, which is important. Oh. I recognize that we're in an overdrive of using our left cerebral hemisphere more than ever for the last 6 months. And we're going in overtime, whether it's work or outside, social media, needing to do it for homeschooling, work, scientific work, everything. So as you said, whatever helps us move a little bit into a right cerebral hemisphere, even if for a few minutes a day, could be art, could be Pokemon, or anything in between is helpful. And then to your point of well-being, you hit the nail on the head earlier that financial wellness is also important. It's physical, mental, and emotional is important, and so is financial. And that's something that is probably looking different. So another piece of advice would be for current trainees to just discuss with people who are important in their life about perhaps planning that a little bit further out. This might be more relevant for those who are parents or who are in a new financial structure, but something that's important regardless, as you mentioned earlier, with some excellent tips.
Yeah, great. Well, thank you so much. That was a really, really excellent conversation. It took Dr. Khan's conversation and expanded in really important ways. So I really appreciate your time. Hang in there down there. I don't know what's going to happen in these next few months, whether it's flu season worsening, COVID going up. I can't predict anything, but take care of yourself, take care of the residents, and take care of our veterans too. Thank you for doing that. That's super important. And I really appreciate your time and all of your commitments, not just to graduate medical education, but to wellness and general education as well.
Thank you, Dr. Isaacson.
Cool.
Team effort. I really appreciate it. And I'm grateful for all of us being in this together, and hopefully we'll get through it. We'll sail through it together, regardless of what occurs.
Yep, I totally agree. Great to chat. Thanks so much for being here.
Thank you. Have a great day.
Thanks.